It's 94.7 BlairRadio.com, our local guest segments and nonprofit news brought to us by Turnkey Nerds, 402-426-NERD, and RVR Bank. I want to say thank you to them for bringing these spotlights to you all the time. So today, again, we get to bring in 3Rivers Public Health, and I'd like to introduce another member of the team. So you guys are all making the rounds coming in here. So just introduce yourself here.
Yeah, I'm Katie Schultes. I work in epidemiology and environmental health at 3Rivers. So I focus on environmental health, things like radon, childhood lead poisoning, well water testing, and then disease surveillance, so monitoring illnesses in our 3 counties.
Okay, so how long have you been a part of that and part of 3Rivers?
I've worked at 3Rivers for about a year and a half now.
Okay. What did you do before that?
Before that, I was a care manager for seniors. I worked at a home care company.
Okay, and so you just made the leap and jump, taking care of seniors and healthcare in that way. You're still doing healthcare, but environmental. How did that come about? That seems like a slight change.
Yeah, well, I always knew I wanted to do something to help people, and there's so many different ways to do that.
Mm-hmm.
I got to start in care management, so working with older adults, building their care plans, assessing their needs, and then finding caregivers around those things. So learning all about their illnesses,
Mm-hmm.
learning about how we can help take care of them, what we can do to make their lives easier, better. And learning about those illnesses and diseases was very interesting to me.
Yeah.
So then I was able to kind of make that transition into epidemiology and public health, and monitoring the illnesses in our communities as well.
And that also goes to where do these come from, probably,
Mm-hmm.
right? Because we have a lot of hidden things in our area, natural or unnatural, that just kind of lend themselves to create some potential health issues, and that's what we need to be looking at. So one thing you mentioned was radon. So this time of year, with everybody has their houses closed up, not airing things out, is this coming more prevalent this time of year?
That's a really great point. Now that it's colder out, a lot of us are spending more time indoors. And if our houses do have high radon levels, the more we breathe it in, the more likely we are to be affected. So the more we're inside, hiding from the cold weather, we're closing our windows, we're kind of stagnating that air. There is the possibility for you to breathe more radon in. So January is actually National Radon Action Month. So this January, we're going to focus a lot on radon. But there are things you can do now, of course, and all year round, like testing your home for radon. We have $1 radon test kits.
Okay.
They're here in Blair. They're at the Washington County Extension Office.
Okay.
We also have them at our health department in Fremont and at the Wahoo Public Library.
Okay.
So they're $1. They're super quick and easy to use. You hang them up in your house for about 4 to 7 days. Don't touch them. Just let them hang.
Just
and
let
then
'em
you
do their
put them in
business.
the mail.
Okay.
So that's all it takes.
Okay, so you hang them, then put them in the mail, and then do you get response, or is 3Rivers Public Health get a response? How does that go?
So both, as long as the person who fills out the test puts their email on the back of the test, they'll actually get an email with their result from the lab. And then I also follow up with phone calls or mail and say, here's your test result. Here's what it means for you. If you need to take next steps, here's what you need to do, and kind of help with that process.
Okay, so again, that's a big deal. Stuff you can start doing now, but next month is National Radon Testing Month, really, is
Yes.
what you want to be able to get out. Okay, so again, get those tests out, especially if you have a basement, right?
Basement or any house that could have some cracks or crevices somewhere that air could seep in from the ground. So
Okay.
you don't necessarily need a basement, but
Okay.
and it doesn't matter how old your house is, how new your house is. It's all about the ground underneath it.
Is there something in particular about Nebraska? It seems like it's more prevalent here than some other places.
We do have really high radon levels in Nebraska, especially the eastern side of the state. I have a radon map. I wish I had it here with me, but it shows the state of Nebraska and where the higher levels are. In that whole east side, we're
It's
all
just
above
really
4,
strong. Yeah.
which is that radon action level where the EPA recommends putting in like mitigation systems and really making some changes.
And what is, for those, it definitely causes health issues. What is some of the health things that you can come across? Or if you start seeing some of these symptoms, what is it that you really need to look for?
Sure. So radon is the second leading cause of lung cancer in the U.S. It's the first leading cause of lung cancer in non-smokers. So even if you don't smoke, if you're breathing in radon in your house, that can actually give you lung cancer.
Wow.
So the thing about radon is you can't see it, you can't smell it, you can't taste it. You would never know it was there. So it's very sneaky, and it's something that we need to be proactive about in testing our house and knowing our limit, knowing our home's level before, unfortunately, some of those horrible symptoms can happen.
Right. Yeah. Being able to be preventative on it. That's what it's all about. Again, so you can get those tests. It's only $1 to get the tests. You can find them at the Washington County Extension, or if you're in the Fremont area, at 3Rivers Public Health or the Wahoo Public Library.
That's right.
Okay. So we'll make sure everybody gets the information out about that. So what else are you looking for? Because I keyed it right in on the radon just simply because I know that people are putting themselves in their homes. But that also doesn't mean they're not getting out and having chances of flus and stuff like that going on.
That's right. And especially with the holidays coming up, we really want to encourage folks, if you're not feeling well, if you're feeling sick, maybe stay home. Maybe don't get around those potentially vulnerable family members, young, old, that could get really sick with things like flu, RSV, COVID. So we really encourage, if anyone's feeling sick this holiday, you may want to stay home from those gatherings. In the meantime, we have a few weeks before the holiday, so there's still time to get your flu shot or your COVID vaccination. It's not too late. So we have our walk-in clinic at 3Rivers in Fremont, so no appointment necessary. You're welcome to just walk in, and that's Monday 7 to 4, Tuesday 7 to 4, Wednesday a bit later, 7 to 6:30 p.m., Thursday 7 to 4, and Fridays are 8 to 3:30. We do have one more Saturday morning clinic. That's going to be Saturday the 16th, and that's from 9 to noon. So if you are still needing your flu shot or your COVID vaccination, we have our walk-in clinic, and we have Pfizer and Moderna COVID vaccinations. On top of that, our clinic is taking new patients and new appointments. So 3Rivers, we offer services such as immunizations, health screenings, confidential and high-quality reproductive health care. And all of our services are affordable, and we accept most medical insurances. But if you don't have insurance, you will not be turned away due to inability to pay. We do have a sliding scale fee, so we really want to be here for the community and make sure that everyone can be served.
Okay, and you can find all this information on your guys' webpage as well as Facebook. So look up 3Rivers Public Health on the Facebook, right?
That's right.
And so be able to get that information out. And now I know it's really early on, and knowing a little bit about it, with the flu shots and stuff like that, they kind of get kind of an approximation of what it is, kind of an educated guess. Do we know the effectiveness so far?
Off the top of my head, I don't know the effectiveness rate so far. I know that this year there's been some really big just leaps in what things can do, like the new RSV vaccine for older adults. So it's really great to see those things, because I remember even last year, so many folks said, I wish I could get this. If they had it, I would get it, because we had higher levels of RSV last season.
Right.
So I'm just really glad that that's something that's out there that people can get.
Again, talking about preventative measures and to be able to live a healthier and be able to get out and enjoy the celebrations and stuff at this time of year. So, okay, is there anything else you were kind of wanting to talk about?
Yeah, just a few quick points here. So at 3Rivers, we have been offering free private well water testing for the last few months, and we're really thankful for everyone who's utilized that program and tested their wells. So in the state of Nebraska, our public water is regularly tested and monitored. So that's going to be your city water, your town water. But if you have a private well on your property, it's not being tested unless you test it yourself.
Exactly. And we, I understand that. We have a well at my place as well. So I understand that.
Yeah. And that's something I never knew before working in public health, even growing up in a house with well water.
Right. And
nobody told us
really
to test.
Funny is that you could have two wells within a certain area and have completely different water.
That's right. So it's very interesting, and we're happy to kind of partner with the Nebraska Department of Environment and Energy. They are offering free well water testing for nitrates across the state. So if anyone would like to test their well for nitrates, that test is free right now, and it's through Nebraska Department of Environment and Energy. We have that on our 3Rivers website, a quick link to get there, or they can look up NDEE as well. But many wells in the state of Nebraska do have high nitrate levels. And there is funding available for folks who have nitrate levels above 10 to actually get a reverse osmosis system placed in their homes. So now's a great time to test, know your level, and if you need to, funding is out there and it could be applied for to help remediate that problem.
Yeah, to mitigate the risks
more
of
prevention.
whatever. More prevention again. And it is a good time of year to be able to do that because everybody's looking for something to do this next month or two. Once we get past the holiday season, we get into kind of the doldrums of, well, it's winter, now what? And so these are things that we can be working on and to be able to prevent, to be able to move forward and be able to get through that. So as we get into, the rest of this month, this next week and next weekend, you have the flu shot clinics coming up. So you have one on Saturday, the 16th. Where's that at again?
That is at our 3Rivers Clinic. That's 2400 North Lincoln Avenue in Fremont. So we have been doing Saturdays this winter season. And our last Saturday is the 16th. So, for our folks who work during the week or are unable to get there, we want to make that extra day where they can get themselves or the kids or whoever needs to come into the clinic.
And if somebody is not able to make some of these targets, can they make an appointment?
They could make an appointment. Those are our clinic hours, but they could definitely call. Wednesday, we're open later into the evening. We're open until 6:30. So for folks come after work, Wednesday would be a great day for them.
Okay, so that is all that's going on. Again, all of this you can find on your website, which is 3riverspublichealth.org.
I believe so.
Yeah, and then also go to their Facebook page. You just look up 3 Rivers Public Health and be able to follow along and get all the information. So, and you guys are doing a great job being able to come in, be a part of it. Last, just over a week ago, you had the resource fair. I just wanted to step back because we were a part of that. So thank you for letting us be a part of that.
Of course.
I thought it was a fantastic event. Can you tell us a little bit from your guys' point of view or from your point of view, how did that go?
Yeah, well, we were super excited to put that on and so thankful for our community to step forward, other nonprofits in our area, and just compile those resources for folks to come in and see multiple resources in our area and know I can go here for this, I can go here for this. So that's just great to get everyone in one area. Of course, Santa was there. You can't beat that.
Yeah.
And I feel like we had a really good turnout, and I was glad to be there. Glad to have our Spanish community, many Spanish community members came out, and we were able to communicate with them and build those connections. And we really just are thankful to serve our community with partners like yourself, and just let people know, get back out in the community, and let people know we're here, what we do, and that we're here to help them.
Yeah, as a education resource and a tool for the community to be able to use. That's what 3 Rivers Public Health's goal is to do. So, again, looking to be able to help you guys get that information out. So, again, thank you for coming in. We will be able to get that out. And, again, if you have any questions, you can always contact 3 Rivers Public Health and their Fremont office, or actually look them up on their website. That's 3riverspublichealth.org, or go to their Facebook page and follow along, be a part of it all. So, again, thank you guys for what you do.
Yeah, thank you so much.